most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to talk about, is your hip pain actually coming from your back and how to tell? We've got some simple questions and some simple tests that you can try.
Absolutely, Bob, because as therapists, we know the two can easily be
Misunderstood or mistaken or
misconstrued.
I don't know. We'll come up with a word. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, you're going to want to join us on our website, bobandbrad.com, because of all the other goodies we got there. We're always doing a giveaway. And right now we're giving away some of our merchandise. You know, if you want our ugly mugs on your mug, here you go. This is the place to go.
There you go.
You can also find it on Bob and Brad on Facebook. It'll be pinned to the top of the page. You want a short version of us, go to Twitter or Instagram. 60 seconds of Bob and Brad a day.
There you go, Bob.
That's probably all about you can put up with.
You can't go wrong with 60 seconds of us.
So, yes, hip pain or back pain, it can be very deceptive because sometimes they share the same locations even.
Yep, similar symptoms. And how many times have you had someone come in with hip pain diagnosis from the doctor and you end up treating the low back and the problem's gone?
Absolutely. This happens all the time.
Yep.
So the first thing we're going to do is ask 3 questions. And by the way, this information is from this book. It's by Robin McKenzie. This man truly was the most famous physical therapist on earth.
Yeah, he's got a whole system that's worldwide. Anyways, we love him.
It's called Treat Your Own Hip. Just came out. We're going to do kind of hip week here, and we're going to do 3 videos on this book alone.
There you go.
So the 3 questions. Number 1, do you have pain in your central low back? That means your middle low back.
By the belt line.
And particularly back pain on the same side as the hip pain.
Sure.
So you're having hip pain, you're like, oh, I always have back pain too. Along with it, it's on the same side. 2, does coughing or sneezing increase your back pain?
Or your hip pain.
Or your hip pain, right.
Create your pain, the problem you're having.
Do you have numbness or tingling or like pins or needles or weakness in the knee or foot on the same side as the hip?
Sure.
You answer yes to all 3 of these, it's more likely that you're having back pain than hip pain.
Right.
Those are the signs of hip pain or back pain, not hip pain.
But not necessarily. We're just saying
it's
more
likely. Right. It's not positive, but it's more likely. Okay, the second thing you want to look at is pain location. So Brad and I have used tape, and my tape is representing what's more typically hip pain.
Right.
Hip pain tends to be more in the groin and also on the side here. This is more what we consider the hip.
Sure.
I know a lot of people consider the hip back here, but this is really more the hip. All right, if you're having pain in the areas that Brad has marked off here.
Is it still there?
Yep, it's still there. In the low back or going down the butt or maybe even going down the leg all the way, then it's more likely back pain.
Right.
Again, not 100%. But your odds are more. If you're a betting man or a betting woman, that's how I would bet.
Yeah, it's really important to understand that pain location oftentimes is not related to the source of the pain.
Right.
It refers, because of the way the nervous system is in the body, refers to different locations. And that, as therapists, we work with it all the time. It just is common knowledge to us. But to the layperson may not understand that.
Yeah, it's weird to think like, shoulder might be sending pain down the arm.
Right.
Or neck pain is sending pain down the arm.
Very similar.
So, all right, the third thing that I want you to try is I'm going to have you sit in a chair, and you're going to sit straight up first and see what that does to your pain.
We got a stool.
Well, a stool or a chair.
Stool's okay.
How about a stool? All right, so you're going to sit in a stool or a chair, and you're going to sit straight up and see what your pain does.
Sure.
Then I want you to slouch like this, and while you're slouching, I want you to grab the bottom of the chair and pull up. That's going to put compression on the spine.
Right.
Pull up.
I think it's pull down, but
pull down with the back, pull up with the arms.
Compress that back
Compress
a little
the
bit.
back. I just did this with a patient yesterday.
Sure.
Because she had a hip replacement,
Yep.
but she seems to be having back pain with it. This caused increased pain. This made her pain worse. So it was more likely her back, because your
Right.
hip is not going to hurt when you do this.
Yeah, there's no extra stress being put on the hip when that happens.
Right.
But it's clearly more on the back.
So you can also test it by standing. Standing, so you stand, put your hands on your thighs, and just go, slide down the thighs like this. Again, this is not increasing the pain on the stress on the hip to any large extent. It's increasing the stress on the back.
Right there.
If this makes your pain worse, again, we're thinking more back pain.
Right.
Same with, you can do extension and standing. You can extend like this or extend like this.
Yep.
If this makes your pain worse, again, more likely to be the back.
Right.
Have I been clear, Brad?
Yes.
Clear as mud? So,
Well-
I had a medical teacher that always would say, am I as clear as mud? He'd always say it like that. Am I clear as mud?
Okay,
So,
Bob. Carry
ah,
on.
it was funny. So that's it, Brad. That's the end of the thing there. And if you are having back pain, obviously you want to treat that, because your hip pain is never going to go away if it's actually coming from your back and you're treating your hip.
So the next question our viewers are asking, well, what are we going to do? We want the pain better.
We're going to have 2 more videos within the next week
Okay.
on what to do. So
Right.
just keep watching on our channel.
And also, this book is written
Oh
for,
yeah, this book is written very good, Brad.
written for the lay person.
Right.
These are usually pretty cheap, around a $10
Yep.
range.
Yep.
And it goes through everything we just went through, plus treatment.
It'll have all the treatment. It'll have everything we're going through this week.
Right.
So
Very good.
all right. Remember, Brad and I can fix just about anything.
Except for.
A broken heart.
But we continue to work on that, and we won't give up until we get there.
We can fix hips though.
Oh, yeah.
So-
That's pretty close.
All right,
Proximity.
thanks.